This is a demonstration video on pouring a rubber mold with plaster, specifically the permanent dentition. The armamentarium for the procedure will include the following. 2 rubber molds. The maxillary arch is the upper jaw and the mandibular arch is the lower jaw. To tell the difference between the 2 rubber molds, refer to the interior portion. The maxillary mold is pointed, which represents the nose, and the mandibular mold is rounded, just like the bottom of the chin. 2 flexible rubber bowls, 1 laboratory spatula to mix the plaster, vibrator, which is used to remove air bubbles when mixing plaster. Best practice is to cover the vibrator with a plastic barrier, including a paper towel at the top. There are 3 settings on the vibrator. The best setting is medium. Using a scale, measure the plaster. The rubber bowl weighs 50 grams. 100 grams of plaster is needed. Zeroing the scale is not required. Add plaster until the total weight equals 150 grams. Using a graduated cylinder, measure 45 milliliters of room temp water and pour it into a rubber bowl. In front of you should be 2 bowls, one with 100 grams of plaster and the other with 45 milliliters of room temp water. We are ready to mix. Full PPEs must be worn. The rubber bowl is held in the palm of my left hand. The spatula is held with my right hand. Add the plaster into the water in steady increments. Allow the powder to settle into the water for about 30 seconds. This helps prevent trapping of air bubbles. Close-up view of steady increments of plaster into the water. Hold the bowl in the palm of your left hand and keep spatulating. Spatulating is another term for mixing. A smooth and creamy mix equivalent to ranch or blue cheese should be achieved. Once the ranch or blue cheese consistency has been achieved, turn the vibrator at medium speed and place the rubber bowl with the plaster mix on the platform. Lightly press the bowl. The vibration forces the air bubbles to rise to the surface. We want this to happen so there aren't bubbles or voids on the anatomic portion of the study model. Dip the spatula into the plaster mix, picking up a small increment. Place the small increment into the mold near the most posterior tooth. Guide the material as it flows lingually and anteriorly. The flowing action pushes out the air ahead of it and eliminates air bubbles. Placing small increments at the most posterior tooth, allow the plaster to flow anteriorly and lingually. Continue to place small increments in the same posterior area and turn the mold on its side to provide continuous flow of plaster to cover each tooth. Once all the teeth are covered, add larger increments until the whole mold is filled. Place the mold on top of the platform for a few more seconds. Remove the mold and turn off the vibrator. Wipe the spatula and remove any excess plaster in and on the outside of the rubber bowl. Plaster has to be completely removed before rinsing the bowl with water at the sink. Plaster should never go down the drain because it clogs it. Rinse and thoroughly dry the bowls and spatula. Place them back in an organized manner. Clean inside and around the sink. Make sure that it is free of any plaster or any debris. All work areas should be clean for the next lab session.